Now, amidst the rising Omicron cases, the centre has asked the states to be prepared for the worst. The Union Health Ministry has written to the states warning them that they might start seeing a stressed healthcare infrastructure in the coming days. The centre has now advised states to build makeshift hospitals at field level to deal with rising caseload. The government has also asked states to activate district-level surveillance. Amid the rising number of COVID cases, various states have imposed COVID restrictions, including night curfews and a ban on social gatherings. Meanwhile, India has now registered over 1,400 cases of the super mutant Omicron variant. Maharashtra tops the dubious chart with over 450 infections, followed by Delhi and Rajasthan. Now, the New Year's festivities brought along a massive spike in COVID infections. Various states imposed a variety of restrictions to curb the spread of COVID-19, including a ban on social gatherings and night curfews. Here's our detailed report.
The New Year festivities on your screens have nothing to be joyful about. These images are scary thanks to the arrival of a new super mutant variant in the last months of 2021. The centre's appeal to avoid overcrowding has fallen on deaf ears. Despite curbs announced by several states, revelers refuse to fall in line. Social distancing and mask rules thrown to the wind. In the midst of festive fervour, India's Omicron tally has crossed the 1,400 mark. Maharashtra tops the dubious chart with over 450 infections. The Mumbai police brought in strict curbs, prohibiting citizens from visiting beaches, gardens or any other public places from 5 p.m. to 5 a.m. till January 15th. Section 144 has also been extended till January 15th.
Now, the Maharashtra government sources are clearly telling us that if such continuous rise in coronavirus cases happens, then there can be a lockdown situation as well. Continuous monitoring has been done and an appeal is made to people that if only necessary, then only they should leave their home.
The national capital is second on the list with over 350 Omicron cases. The Delhi government issued a yellow alert on the 28th of December. A night curfew has been imposed from 10 p.m. till 5 a.m. Schools, spas and gyms are shut.
With spike in Omicron cases across the country, there has been a spree of vigilance mechanism that is put in place. Despite so, the spike continues. The tally has crossed the 1,400 mark. The Delhi government has also asked that any person with fever should be treated as COVID positive. This is the kind of measures that's being taken in place.
And what we know by our data, what has been provided by Delhi government, around 40 to 50% are Omicron, right?
Right.
Now, this is going to be difficult because we all know that Omicron is milder and Delta can be severe. But we need to watch for our symptom. We need to watch for the severe symptom in any given patient.
Tamil Nadu, meanwhile, imposed fresh restrictions in the state till January 31st. There will be no in-person classes for students of grades 1 to 8 till January 10th. Play schools, nursery schools will not be allowed to function. Restaurants, theatres, entertainment and amusement parks will be allowed at half occupancy.
There are a list of restrictions which the state has put till the 10th of January, and it's been said that people need to be more conscious about the entire Omicron as well as COVID situation. It is seen that of the 120 cases that were reported, only 57 of them had international travel, while 63 others have not had any links of international travel.
The situation remains the same in other states too. Curbs have been imposed.
Karnataka recorded 23 new Omicron cases on New Year's Eve. With new cases being recorded, the Karnataka government has strictened restrictions across the state and the city. With all these restrictions in place, the Karnataka government hopes to curb the rise of Omicron cases in the state.
With shoppers overcrowding markets and party lovers refusing to follow COVID-appropriate behaviour, the rise in cases doesn't seem to end anytime soon. Bureau Report, India Today.
Now, meanwhile, 10 ministers, 20 MLAs in Maharashtra have tested positive for COVID-19 after attending some weddings. In fact, Maharashtra Deputy Chief Minister Ajit Pawar has said stricter curbs are likely to be imposed if at all cases surge. Have VVIP weddings become the super spreader events? Are VVIP weddings causing a spike in COVID cases on the whole? Our next report tells you that.
Maharashtra continues to battle a COVID surge. From citizens to Bollywood celebrities, the contagious virus hasn't spared anyone. But now even netas are in the grip of COVID. 10 Agadi ministers and 20 MLAs have tested positive.
कोरोना खूप झपाट्याने वाढतो. मी मागेही काहींशी आपल्याशी बोललो होतो. 5 दिवसच अधिवेशन आम्ही ठेवलेलं होतं. तरी 5 दिवसामध्ये जवळपास आतापर्यंत 10 मंत्र्यांना कोरोनाची लागण झालेली आहे. जवळपास 20 पेक्षा जास्त आमदारांना कोरोनाची लागण झालेली आहे. प्रत्येकाने लोकप्रतिनिधी असेल किंवा कुणी नागरिक असेल.
Pawar's revelation comes days after Maharashtra's Women and Child Development Minister Yashomati Thakur tested positive. With no large gatherings and parties allowed, the Maharashtra government said it would have to bring in restrictions if the surge continues. This comes at a time when pictures of prominent politicians attending extravagant weddings went viral. From the wedding of Maharashtra Minister Jayant Patil's son, BJP leader Harshvardhan Patil's daughter's marriage to Bal Thackeray's grandson, or the sons of Sena MLC Ravindra Phatak and Sena MLA Uday Singh Raj, and the son of former BJP MLA Shivaji Rao Kardile. Earlier in November, a video of Supriya Sule dancing with Sena MP Sanjay Raut at his daughter's wedding also emerged. Agadi leaders have defended these super spreader events.
आणि लग्नांचे विषय आहेत. हळूहळू त्यातून मार्ग निघेल, कारण ही लग्न आधीच ठरलेली होती. मुहूर्त आधीच ठरलेले होते. तरी लोकांनी अनेक बंधनं पाळली. मी गेल्या काही दिवसापासून पाहतो.
Is a COVID spike among Agadi netas due to complacency? Bureau Report, India Today.
Now, registrations for teen vaccine kick-started on Saturday amid surge in COVID and Omicron cases across India. Both walk-in and online registrations via CoWIN portal has been initiated for 15 to 18 years old. In fact, after getting the vaccines, children will receive their vaccination certificate on the Arogya Setu application. They can also download it from the CoWIN portal. 15 to 18-year-olds will be given the Bharat Biotech's Covaxin shots. Separate vaccine centers have also been set up in hospitals across states. While vaccines at government hospitals in the national capital will be free, a single dose of Covaxin will cost about 1,250 rupees in a private hospital. Children will get their first jab starting 3rd of Jan.
Kids are the most vulnerable at this point in time. So that's the responsibility of all the parents, and thanks to the government that they have really taken up this. And I'm really, hopefully today I will get the registration done and get over with. It's a responsibility as a parent and also as a citizen that we must get as many people vaccinated. I have a daughter who's 12 years old, so she's the next in the line.
हमें पूरा यकीन है कि ये वैक्सीनेशन बच्चों के लिए भी उतना ही सेफ होगा जैसे एडल्ट्स के लिए था. जो भी ट्रायल्स हुए हैं बच्चों पे इस वैक्सीन को लेके, अभी तक उसमें से ऐसी कोई भी डेटा नहीं आया है जो सजेस्ट करे कि कोई सीरियस साइड इफेक्ट्स होगा. तो जैसे एडल्ट्स को या किसी भी वैक्सीनेशन से थोड़ा बुखार, थोड़ा हाथ में दर्द हो सकता है, वो साइड इफेक्ट्स ज़रूर हो सकते हैं बच्चों में, बट उसके अलावा ऐसा नहीं लगता कि और कोई सीरियस साइड इफेक्ट्स होने के चांस है.
Now, Israel reports new infection of corona, the florona disease. A pregnant woman, in fact, was admitted to a hospital, a medical facility to give birth. She was detected with florona. That's the variant of the virus. In fact, the young woman there was not vaccinated, is what we believe. Florona disease is a double infection of COVID-19 and influenza. Florona is indicative of a severe lapse in the immunity system because two viruses are infecting the human body simultaneously. According to data so far, a number of symptoms can be seen simultaneously in a person infected with florona. This includes pneumonia, in fact, myocarditis as well as other respiratory issues. At least 12 people were killed, 15 others were injured after a stampede occurred at the Mata Vaishno Devi shrine in Jammu and Kashmir's Reasi district. In fact, the injured were taken to Narayana Hospital. 4 among them were discharged. Here are some details that you see in this report.
Horror, panic and complete chaos. Look at these horrifying images on your screen. At around 2:45 a.m., a shocking incident of stampede occurred at the Mata Vaishno Devi Bhavan in Jammu and Kashmir's Katra. This video, shot by a devotee present at the spot, captures the panic and the alarm at the holy shrine. Jammu and Kashmir DGP Dilbagh Singh said that the CCTV footage of the stampede site was being examined and a further probe into the incident was underway.
It's more of a confusion, no one knowing what is happening and everybody running helter and skelter. That is what happens in the stampede actually, and that is what leads to the loss. Most of the I think deaths have taken place because of the suffocation, because of people being run over by each other, and most of the injuries are also due to the same region.
India Today was the first channel to reach Vaishno Devi and bring the exact picture of all that transpired at the auspicious site in Katra.
पब्लिक यहाँ से आती रही, वहाँ से दर्शन करके आती हुई, तो वहाँ पे काफ़ी लोग जमा होते रहे बाहर निकलने के लिए, यहाँ से लोग जाए नहीं, तो यहाँ के लोगों ने धक्का दिया, यहाँ के लोगों ने धक्का दिया, उस चक्कर में हो गया। बच्चे लोग नीचे फैले हुए थे सर, लेडीज लोग बहुत दबी हुई थी।
In the midst of panic, here was a devotee trying hard to help save a fellow devotee. He was seen performing CPR to one of the victims, desperately trying to do all that he could to help. Witnesses to the tragic incident blamed the government for not taking enough steps to manage the crowd.
बॉडी भी उठाने वाला सर कोई नहीं था, पब्लिक में से बॉडी उठाया गया है, स्ट्रेचर भी इनके पास अवेलेबल नहीं था, मेडिकल के नाम पे कुछ भी नहीं था, डॉक्टर कोई भी नहीं था,
पर्ची चेक ही नहीं करी, ये तो प्रशासन की गलत है, पर्ची है, इनको चेक करेंगे, हमारे पास सबके पास है, ई टिकट है, ये तो गलत है, ये सारा जनता पे जो लगाया जा रहा है, ये गलती मैनेजमेंट की है।
Devotees who suffered the stampede horror narrated their ordeal.
बहुत ज़्यादा अफरा तफरी थी, ऐसा हो गया था कि मतलब मेरे बच्चे डर गए थे, देखने को बहुत ज़्यादा भीड़ हो गई थी जो काबू में भी नहीं आ रही थी।
तो बच्चों की जान कैसे बचाई आपने? आपकी पत्नी थी साथ में?
मेरी वाइफ ने उनकी जान बचाई, जो कि उनको मेरे बच्चों को लेके साइड में हो गई थी, इस वजह
साइड में चली।
हाँ जी, इसी वजह से मेरे बच्चों की और मेरी वाइफ की जान बची।
मेरा भाई खुद अभी सीरियस है, वेंटिलेटर पे है, मैंने उसको बहुत मुश्किल से वहाँ पर मैंने देखा, जब वो उसको
सगे भाई या
कज़न मैंने उसे उठाया, मैंने देखा वो कुछ नहीं कर पा रहा था, वो बेहोश हो गया था, उसको उठाया।
Prime Minister Narendra Modi also expressed his condolences for the victims who lost their lives.
माता वैष्णो देवी परिसर में हुए दुखद हादसे पर शोक व्यक्त करता हूं। जिन लोगों ने भगदड़ में अपनों को खोया है, जो लोग घायल हुए हैं, मेरी संवेदनाएं उनके साथ है।
Within hours, Union Minister Jitendra Singh rushed to Katra to visit the injured devotees and take stock of the situation.
Out of this entire tragic episode, the only matter of satisfaction is that those who have been hospitalized, none of them have a bad prognostic sign. I mean, most of them will come out.
The Jammu and Kashmir Lieutenant Governor Manoj Sinha also visited the hospital to meet the injured pilgrims. While the yatra resumed after a brief pause, several questions were raised on the violation of COVID protocols, the absence of social distancing and the lack of curbs on mass gatherings.
Large number of devotees had gathered at the holy shrine of Mata Vaishno Devi. But still, you can see that more number of yatris are arriving, and it has led to chaos in Katra town. We can see large number of devotees, long queues of devotees here in Katra town. They have not even reached the entry point of the yatra. Imagine the situation here. So the situation is going out of control.
Both the central and the state government announced compensation for the victims of the tragic incident. An ex gratia of 10 lakh rupees was announced for the kin of those who died and an ex gratia of 2 lakh rupees for those injured. With Sunil J. Bhatt in Jammu, Bureau Report, India Today.